Okay. So we'll start with extreme left. When there is body temperature increases. So this all are, again, we are discussing the normal things. We are not yet enter into the fever thing. Okay. So when the body temperature increases, blood temperature is also increases. And when blood enters into the hypothalamus, it goes to the anterior hypothalamus at pre-optic nuclei. There are there are two main groups of nuclei in the hypothalamus, anterior and posterior. So when the body temperature increases, obviously the temperature of blood is also increases. When this blood goes to the hypothalamus, when it goes to the anterior hypothalamus, in that also typically when it goes to the pre-optic nucleus, then there will be stimulation of this anterior nucleus. And why this nucleus is stimulated is because on the preoptic nucleus of anterior hypothalamus, we have heat sensitive nerve cells. Those are called as thermoreceptors. See, this is very physiological. When the body temperature increases, blood temperature increases, such blood goes to the hypothalamus, and in the hypothalamus what we have is the thermoreceptors. What are thermoreceptors? These are heat sensitive receptors. So when the blood increase, they can easily sense the increase the blood temperature. Okay. And when this thermoreceptor gets activated, it tries to bring the temperature to normalcy by two ways, because the body temperature has increased and hypothalamus have to bring them to normalcy. And how it do so is by two ways. First, what it will do, it will promote heat loss, and second, it will prevent heat production. Okay. And how it will promote heat loss is, first, it will increase sweat production. When the sweat production increases, more water will be lost from the body. Along with water, heat is also lost. And second thing, what it will do is it inhibits sympathetic center in the posterior hypothalamus. When this sympathetic center in the posterior hypothalamus gets inhibited, it causes cutaneous vasodilation. So once the cutaneous vessels, that is vessels in the skin, are gets dilated, what it will do, there will be increased heat loss through radiation. Okay, this already we have discussed the ways of heat loss. See, there are different types of heat loss from our body. First is by radiation, and how it occurs is directly through by exposing to environment. When the vessels are getting dilated, means lot of blood will be flowing through the capillaries. When lot of blood is flowing through the capillaries, lot of heat is getting radiated from the body, and it will help to bring the temperature to normal level. Okay, so there are two ways to bring the temperature to normalcy when it is increased: by promoting heat loss and preventing heat production. Okay, so when the heat loss is promoted, how is by increased sweat secretion, and second, by inhibiting sympathetic center in the posterior hypothalamus, which causes cutaneous vasodilation and which increases heat loss through radiation. Okay, so these both are the efforts to bring temperature to normal level. So this is about the first part. What about second? So this anterior hypothalamus will be preventing heat production. So it is very simple mechanism. If body temperature is increased, do such things which will cause heat loss from the body and prevent excess heat production in the body. So how it will prevent excess heat production is by inhibiting shivering and by inhibiting metabolic rate. So when the metabolic rate reduces, less heat is produced in the body, and these two are also will help to bring the temperature to normalcy. So how shivering will be affecting the body temperature? See, when the patient shivers, there will be severe contraction of muscles, and this severe contraction of muscles will be generating enormous amount of heat. And what the hypothalamus will be doing here, it is inhibiting shivering. So once the shivering is inhibited, means no heat will be generated. So the temperature will come to normalcy. So in the metabolic processes is also ATPs will be generated, and those are responsible for the heat production in our body. So when the metabolic rate slows down, less heat will be produced. So these are the four efforts. Shivering is third, and fourth is metabolic rate. So these are the 4 efforts to bring the temperature to normalcy. Okay. So who is doing this? Is again anterior hypothalamus. In short, when the body temperature increases, anterior hypothalamus comes into action, and when the body temperature decreases, posterior hypothalamus comes into action. So what we have discussed is when the body temperature increases. Next, we'll move when the body temperature decreases. So what mechanism happens when there is physiologically decrease in the body temperature? See, when we say temperature, it is not constant. That is not like 37.37 degrees centigrade will be constant throughout the day, throughout the night. It's not like that. It will be varying. So that's why we maintain, we say range as a normalcy. And hypothalamus will be try to maintain around that set point. It is not like exactly it will maintain the 37 degrees centigrade. Okay. So it is around. So when this physiological variation takes place, to maintain to normal thermoregulatory set point, this hypothalamus will be doing so. So when there is physiologically decrease in the body temperature, blood temperature also decreases. When this blood passes through hypothalamus, typically in the posterior hypothalamus, it is going to stimulate heat gain center. So there are 2 centers. I'm repeating this lot of time. On the anterior pituitary, we have heat loss center, and at the posterior pituitary, we have heat gain center. Okay. And what this heat gain center do? It will try to bring temperature to normalcy again by 2 ways. How? First way is preventing heat loss, and second, promotion of heat production. So you can imagine already the temperature has been gone down. So someone has to lift this temperature. Someone has to increase that temperature. And who will do so? Posterior hypothalamus will do. And how posterior hypothalamus will increase this temperature? It will prevent heat loss and it will promote heat production in the body. Okay. So by preventing heat loss means, first thing what you need to do, we have to decrease the sweat secretion, because we don't want water and heat to go out of the body. Okay. So what it will do? First, it will decrease sweat secretion. So reduced water and heat loss through the skin. Hence, it helps to bring temperature back to normalcy, means helps to increase the temperature. Second, it will stimulate sympathetic center in the posterior hypothalamus, so that it causes cutaneous vasoconstriction. So when the cutaneous vessels are getting constricted, that is capillaries in the skin are getting constricted, so there will be reduced blood flow to the skin. Reduced blood flow to the skin means reduced heat loss to radiation. So if through radiation less heat is eliminated, obviously there will be increased in the body temperature. So this is about preventing heat loss. Now second effort what posterior hypothalamus will do is it try to stimulate the primary motor center for shivering. Okay. If the primary motor center for shivering gets stimulated, the patient starts to shiver. So what is shivering? It is in severe muscular activities. So when this severe muscular activity takes place into our body, there will be enormous heat production in the body, and this heat production will help to bring the decreased temperature to normalcy. What is the next thing is this posterior hypothalamus, especially heat gain center, will increase the metabolic rate into our body. When the metabolic rate in the body increases, lot of heat is generated, and it will help to temperature to come to normalcy. So this is happen physiologically when there is reduced body temperature. Let me explain this once again. Okay, when the body temperature decreases, when the body temperature decreases, blood temperature also decreases. Okay, and this blood when passes to the anterior hypothalamic nucleus, especially preoptic nucleus, who have the heat sensitive receptors like thermoreceptors. Okay, one thing I forgot to mention here. There are 2 types of thermoreceptors. First is the central and second is the peripheral. So central receptors will be receiving impulse from CNS and all internal organs, and peripheral receptors will be receiving impulse from the skin. Okay. So coming back to the thermoreceptors on the anterior hypothalamus. So when these thermoreceptors senses that the blood temperature is increasing, so it will try to bring the temperature to normalcy by two ways. First, it will promote heat loss. Whatever the heat is generated in the body, it will try to expel that heat out of the body. And second thing, what it will do, it will prevent heat production. So how it will promote heat loss is by increasing sweat secretion and by inhibiting sympathetic center in the posterior hypothalamus. Okay, so when the sweat secretion increases, excess water and heat lost from the body, and this is one effort to bring temperature to normalcy. Second, when the sympathetic center in the posterior hypothalamus gets inhibited, it causes cutaneous vasodilatation, and hence there will be increased heat loss through radiation. Second, how it will prevent heat production into our body? By inhibiting shivering and by inhibiting metabolic rate. So less heat will be produced and the temperature will be taken back to normalcy. So this is what happens when the body temperature increases. And when the body temperature decreases, what will happen? The blood temperature is also decreases. Again, it passes through hypothalamus, especially to the posterior hypothalamus. And now posterior hypothalamus will be stimulating heat gain center. Okay, so body will try to gain heat by different ways. And there are only two ways to gain the heat. What is those? What are those? First is prevent heat loss. So the heat will stay into the body only. And second is promote heat production, generate more heat into body so that the temperature will increase and we can maintain the thermoregulatory set point. Okay, so how the heat loss will be prevented? Reduce sweat secretion and stimulate sympathetic center in the posterior hypothalamus. So the cutaneous vessels gets dilated, vessel gets constricted, so the less blood will enter to the skin. So heat loss through the radiation will reduce and temperature will come to normalcy. Second, how the body will promote heat production? Stimulate primary motor center for shivering so that the patient will have severe muscular activities and heat will be generated and increased metabolic rate. So this is how the hypothalamus will be maintaining thermoregulatory set point in normal person. Okay,